All right, Dr. Stepovich, we did discuss clear braces. I mean, we discussed the Invisalign, which is very clear and basically Invisalign. But I know there's also other braces on it, which are, I think they're called clear braces, and I think you mentioned them slightly. They're perhaps made with glass versus metal. And they come in all colors: yellow, green, blue, white, red, name it. Anyway, give us some explanation about those braces. Versus the metal braces. Always kind of like make a small comparisons to the other type of braces of the whys and what's behind, without re-explaining the other type of braces. Go ahead.
Okay. For the children, there are people who manufacture braces in the shapes of stars, or soccer balls, or basketballs, or footballs. And so you can get a set of braces.
What about hearts? No hearts?
Hearts. Oh, that's right. No, they do make hearts, and there's no end to what can be made. And they have a bracket on there. It's disguised in that design, but what you see is a star or a football or a heart. And but then the wires fit into it, and it acts just like all the other braces. But some braces are larger than others, and the most popular braces are those that you can put colored ties on. I mean, they're the most prevalent, so that to hold the wire into the bracket, you use a little O-ring, and those O-rings come in different colors, so you can give the patient, red and green for Christmas, and red for Valentine's Day, and orange and black for Thanksgiving, and so on. So
it's a fashion show.
Yes, and that's been really helpful for a lot of the teenage people that just to see. We have all kinds of companies.
Right, Dr. Stepovich, are we talking? I mean, I started off this conversation with a topic called clear braces. Are those the clear braces, or is this another type of braces?
No, these are all metal braces. Okay, and then there are the braces that are the same shape and size, but they're made of glass. And they call them, there's all kinds of different glasses, types of glass that these are made from. And some of them have metal inserts in them, because the clear braces, the glass, you still have to use a stainless steel wire in there to put the force on the teeth to biologically cause the tooth to move to a new position. But the friction between stainless steel and glass doesn't allow that bracket to be very efficient. So they line them with stainless steel. Now the stainless steel is sliding with stainless steel. Metal brackets are stainless steel, so you don't have that problem. So the coefficient of friction on the glass braces are very high, and so the treatments take longer. Because
you can't move them as fast, because the glass and the metal, it will break.
Yes, and so then the braces have a square slot, and when you put a square wire in there, then you can move the tooth in a direction that you cannot with a round wire. So when you put that wire in there and it's torqued, and instead of being in line with the square slot in the bracket, you change it a little bit so you can move the tooth. And when you do that torquing with the metal braces, there's no problem. The wings of the bracket aren't affected. But in the glass, they break. Okay. So you cannot make as much of an adjustment with each appointment.
Right. So it takes a little longer. How much longer on an average? 2, 3 months, 4 months longer than with this. Let's, same condition in the mouth, metal braces versus the glass braces or clear braces. Are we adding on 4 months on treatment, 1 month? What are we doing?
I think you're adding 4 to 6 months on your treatment, and you're adding in most offices they cost more.
Okay.
Also because of that.
Oh,
so they are more expensive than metal braces, and they also they take longer to treat, so you charge more. So
right.
So that
I understand.
Metal braces still are the best. And so,
but let's go from the viewpoint of the patient and the kid or the adult wearing it. Are they better looking, those glass ones? So let's see, goes same with the Invisalign. Invisalign might take a little longer, might have a few things, but in terms of, for some people, that particular look, the ones who cannot imagine their metal braces being jewelry, so they say, I want as little possible seeing, or like the way it feels with, your tongue or with other thing, is there some advantage on that for those people so that they say, okay, $500 more or $1,000 more and 4 or 5 months longer, fine, Mom, please, I want those ones. Do you find that? Do you see that? Is that happening?
It's very interesting. I put clear braces on because the patient wanted to have clear braces. They didn't want them to show, and they at a little, at a conversational distance, when a patient has clear braces on, that there's something wrong with those people's teeth when you're looking at them, and you say, well, did they brush today, or what is it that they have on their teeth? Because it comes out to be a little muddy as to what it is. And some of the patients say, that's right, I look like I'm faking it. I'm doing some kind of fake thing here with this with these clear braces. And so I have patients that I don't want any of those clear braces because they look funny. I like metal. They look like jewelry, and I can keep them clean and nice. Okay. Now the metal braces have been used by some offices. They automatically put the clear braces on, okay? And even the ones that want the clear braces, comes Christmas time, they want to put the colored ties on there. And so now they're not hiding anything. They're displaying their braces with the colored ties on them.
Can they do that with the clear braces?
Yeah. And so that's actually befuddling to see that happening, but that's fine. If the patient wants that, well, we're going to accommodate that, and they like that, and it makes it enjoyable for them. That's fine.
Sure.
And so we do that, but it is kind of an oxymoron thing that they put the braces on because they didn't want anybody to see them, or sort of hide them and not show a lot of metal, and now they're going to put colored ties on there to show off Christmas or New Year's or Valentine's Day or something. So
it looks to me that perhaps one of the biggest disadvantages of those clear braces could be not necessarily they cost a little more, which of course in an economy like today, could be a problem. Money doesn't grow on the trees, and every dad probably knows that. But and that it take a little longer, again, it's time for the parents and for everybody to, out. However, it looks to me that it's like so many things in our society, it's an almost thing. So on one hand, it's clear, but it's not clear. So it's just unclear enough that it, as you said, this might be even more funny to what's wrong with this guy's teeth? Does he have something stuck on it? Because if there is a metal on it, it's a metal, and everybody recognizes this. Oh, that guy's wearing braces. No big deal. No attention on it. But like,
that's correct.
what is that? Do you understand? If I have a polka nut shirt, everybody knows I have a polka nut shirt. They may like it, they may not like it, but they know I have a polka nut shirt. But if I have like little fading polka nuts and just one or two, then people go and say, is this guy wearing a dirty shirt?
Yeah, so I have orthodontists that won't use them at all because of the problems that they have with them. And
well, let me ask you something else. That's a patient calling saying, I want my Christmas tree on my teeth. I want a red tie on my tooth. Anyway, let me ask you. Are there braces? I've heard about it, and maybe that is what we're talking already. I don't think so, because you said there's something braces where actually the wires and that metal thing goes in the back on it, and you never see it.
That's correct. Right. No, they have braces on the inside of the teeth. Definitely, Helmut, that is correct. That they're called lingual braces, lingual being tongue. So they're lingual braces, and they are more difficult to do treatment with, but some minor treatments like malalignment of the lower teeth, the lingual braces are getting popular in that area.
Good, and
so
you do that.
That way, you don't show any braces at all, but your tongue takes the beating because it's got all these things it has to get used to, and some patients just can't tolerate it at all, and you have to take them off and put the braces on the outside of the teeth.
I got it. Is there a speech inhibition?
It is with the upper teeth. It is with the upper teeth. Now, there's only one sound that's made against the lower teeth with the tongue, and that's the TH sound. And all the rest of the sounds are made with the tongue playing with the upper teeth.
Okay.
So
I think I pronounced the TH on the top, which is why having a German Austrian accent, why nobody can understand my TH. I pronounce it with the wrong part of the mouth. You might just have solved the speech problem of mine. I love it talking to you. Well, all right, Dr. Stepovich, thanks for shedding some light on clear braces and on baseball braces and all that type of stuff which can be done. It's fascinating, actually. Bye-bye.